Good morning and good afternoon, everybody. It's my huge pleasure to join all of you in this lunch debate at the European Parliament. And the theme of the debate is to focus on to hear for life and listen with care. My name is Satish. I'm the Regional Advisor on Disability Rehabilitation, and as well as I follow the agenda on palliative care and long-term care for the WHO Regional Office for Europe, which is based in Copenhagen in Denmark. I'll be speaking today about ear and hearing care in Europe, the current status and the future directions on ear and hearing care in the WHO European region. To start with the numbers, we estimate today in WHO European region, 196 million people in the region live with hearing loss. We estimate that this number will increase to 236 million people with problems of hearing care by 2050. This clearly indicates that hearing loss is on the rise. If we talk about the disabling hearing loss, in Europe, 57 million people require hearing rehabilitation. And this need is likely to rise over 71 million people by 2050. Most people with hearing loss do not have access to the interventions they need. The gap in services is huge. If you take one single tracer indicator on the need of hearing aids and their actual use by those in need, we find that there's a gap of 77%, of over 77% in the European region. This is despite the fact that country in the European region, WHO European region, there's highest concentration of human resource compared to other WHO European region. In spite of that fact, we see that 67% of the countries in the European region has only more than 50 specialists per 1 million population. Unaddressed hearing loss has a wide range of impact on those affected, their families, and society at large. It affects listening and poses challenges for everyday communication. In children especially, it hampers development of language and speech. It is associated with delayed cognitive development in children, as well as cognitive decline in adults. It impedes their educational attainment and makes it difficult for people to find and retain jobs. Hearing loss often causes social isolation and is a cause of relationship disharmony, leading to feeling of loneliness, low self-esteem, depression, and dementia. If you talk in economical terms, ear and hearing care services comes at a very high cost at a societal level. We estimate that annually 225 billion US dollars are lost, mainly due to loss of productivity and social isolation attributed to unaddressed hearing loss in the European region. At a global level, this cost is 980 billion US dollars are lost due to loss of productivity and social isolation. Whereas in the European region, is 225 billion US dollars. The fact, and this is the good news, that it is possible to have good hearing across the life course. Solutions are available that can prevent and address hearing loss so that all people have the chance to achieve their full potential. This requires strong and coordinated public health action that includes measures for prevention of hearing loss at a population level, ensure early identification of hearing loss at all ages, and provide timely and appropriate care for all those in need. In the next few slides, I'll expand more on these solutions. In terms of prevention, solutions are available to prevent many causes that lead to hearing loss. In children, for instance, 60% of hearing loss is attributed to preventable causes such as rubella, low birth weight, birth complications, etc., all of which can be prevented through public health measures. Later in life, also protecting ears from loud sounds, avoidance of ototoxic medicines and chemicals, as well as healthy lifestyle choices can prevent the occurrence or progression of hearing loss. When hearing loss occurs, it is important to identify it at the earliest possible in order to have successful outcomes. This can be done through systematic screening of newborns, preschool and school-going children, adults in high-risk occupations, as well as in older adults. Moreover, it is possible to identify hearing loss at all stages of the life, from the birth till the old age, and in all settings, whether in community or in school settings or in work settings. Innovative and automated hearing testing has made it possible to reach everyone and everywhere. Such efforts, when supported by telemedicine, can ensure quality of care for all. Once hearing loss is identified, it can be effectively addressed through a holistic approach that includes provision of hearing technology such as hearing aids and implants, along with supportive rehabilitation therapy. In addition, people can also benefit through the use of sign language as well as lip reading. Despite the fact that solutions are available to prevent and address hearing loss, the field of ear and hearing care faces many challenges. On one hand, there is a steadily growing number of people in need of ear and hearing care, driven by the demographic shifts. On the other hand, the health system do not have the capacity to provide ear and hearing care services, mainly due to lack of human resources, lack of policies, finances, as well as devices and equipment. In addition, at the level of the community and among the policymakers and even healthcare professionals, there is a persistent lack of awareness about hearing loss. These problems are further magnified by the stigma linked with ear and hearing problem. That is a key challenge that we need to address in this field. The good news is that these challenges can be addressed, and as the World Report on Hearing shows, there are numerous examples which have been implemented at the country level through innovative and evidence-based strategies. To address the challenges faced and move to a path of universal health coverage, where everyone can access ear and hearing care without financial hardship, countries need to adopt an integrated people-centered approach to ear and hearing care, which can be implemented through a standard health system so that all people can have equal access to quality of care. The World Report on Hearing outlines the vision on integrated people-centered ear and hearing care, which is detailed through an acronym, hearing interventions, and delivered through a standard health system. I'll speak about them in a moment. The World Report on Hearing proposes a package of evidence-based intervention, acronymized as Hearing Package of Intervention. These range from hearing screening and intervention. Number 2, ear disease prevention and management. Number 3, access to technology. Number 4, rehabilitation services. Number 5, improved communication. Number 6, noise reduction. Number 7, greater community engagement. Countries should determine which intervention best suit their needs by conducting an evidence-based consultative prioritization exercise. Ensuring access to prioritized interventions and services require action at all levels of the health system. This includes policy development, building human resource capacity through education and training, task sharing, standardized guidance and practices for procuring health hearing technologies, ensuring financial and social protection, as well as setting targets and indicators for ear and hearing care. Investing in integrated people-centered ear and hearing care is important because it is both essential for good functioning for those who are at risk of living with ear and hearing problems. It is also cost-effective. The World Report on Hearing estimates that an additional annual investment of less than $1.4 per annum can benefit 1.4 billion people over 10 years, averting 130 million disability-adjusted life years and bring return of $16 for every dollar invested on ear and hearing care. With these considerations, the World Report on Hearing presents a call for action, calling upon WHO member states and countries to scale up ear and hearing care for achieving global targets of 20% relative increase in ear and hearing care by 2030. We need to act now for ear and hearing care because there's a growing number of people with unaddressed hearing loss and ear disease is simply unacceptable. Hence, urgent action is needed to prevent and address hearing loss across the life course. This can be done by investing in a cost-effective interventions, which will, on one hand, benefit people with hearing loss, and on the other hand, will bring financial gains to the society. Countries must act now to integrate people-centered ear and hearing care within the national health plans for universal health coverage. For the cost of doing nothing is one we cannot afford. I thank you very much for your attention, and I wish you all a continuation of this debate. My colleague, Shaili Chadha, will be available to respond to any of the questions and queries which you may have with regards to ear and hearing care in the European region. Thank you very much for this opportunity. Bye.